My name is Karen Selby. I'm a registered nurse and a patient advocate at the Mesothelioma Center at Asbestos.com. Many people reach out to me asking, what are the most common signs and symptoms of mesothelioma, a very rare but serious cancer caused by asbestos exposure? The most common symptoms are shortness of breath, fatigue, chest pain, rib pain, lack of appetite, and night sweats. It's important for someone with a history of asbestos exposure to understand what the symptoms are. They're common to many types of other diseases, so you wouldn't ordinarily think this is something I need to be concerned of. So knowing the symptoms will help you and your doctor get a diagnosis sooner. The most common type of mesothelioma is pleural mesothelioma, which affects the lung lining. The most common symptoms associated with pleural mesothelioma are chest pain, fatigue, shortness of breath, lack of appetite, weight loss, and night sweats. The most common type of mesothelioma is pleural mesothelioma, which affects the lung lining. So essentially, it's a cancer of the lung lining associated with asbestos exposure. It starts to develop as a film on the outermost layer of the lung. The second most common type of mesothelioma is peritoneal mesothelioma, which affects the abdomen. It has some similar symptoms, such as lack of appetite and night sweats, but other different symptoms may be bloating, swelling of the abdomen, and abdominal pain and change in bowel habits. Another rare type of mesothelioma is called pericardial mesothelioma, which affects the heart lining. It has very similar symptoms to pleural mesothelioma, such as chest pain, shortness of breath, difficulty breathing when exercising, weight loss, night sweats, and decreased appetite. Testicular mesothelioma is the rarest type of mesothelioma, which affects the testes, or in other words, the lining of the testes. Symptoms of testicular mesothelioma is swelling of the scrotum, and possibly a lump will form. A misdiagnosis of mesothelioma can be common because the first signs and symptoms are so very similar to many other diseases. So it's not the first thing a patient or even a physician is going to hone in on when trying to determine what is causing the symptoms. Symptoms of mesothelioma are very similar to many other types of diseases. So it becomes concerning when these symptoms are chronic. If you're finding that the symptoms aren't diminishing over time, say a month, it would be important to discuss this with your physician and also your history of asbestos exposure. There is a latency period of anywhere from 20 to 60 years after a first diagnosis before symptoms may occur. Symptom management for mesothelioma is important. It's not a curative cancer, but it can be managed. Palliative therapies such as pain management and fluid drainage may help. Supportive care such as respiratory therapy, physical and occupational therapy can alleviate symptoms. Complementary methods like gentle exercise, nutrition, emotional, and psychological support may also help. If you're experiencing any of the symptoms associated with mesothelioma, it is important to discuss them with your physician, along with your history of asbestos exposure. An early diagnosis is key to offer the most options for your symptom management and treatment.